Welcome to the webinar. This is the Let's Talk About series, and this webinar is specifically around personal assistants having COVID vaccination and testing. We've been really overwhelmed by the amount of people that have wanted to register and attend the webinar. So we will be recording it so that others are able to see it and hear what's being said. So this webinar is part of the Be Human Let's Talk About series, and we've been hosting various subjects that are important to people. And obviously this one around personal assistants getting their vaccination and testing is massively important and current at the moment. I'm Julie Stansfield. I'm also joined by Tricia, Nicole and Gaynor, who are part of the Be Movement team, and we'll be hosting and facilitating this. But we're also really pleased to be joined by Steph and Katrina, who you'll be able to see on screen, who are training interpreters. So thank you both and welcome. So just a reminder that we are recording this webinar. So how to participate, if you've not joined one of these webinars before, is you'll see a box like this, and you're able to, once the presenters have finished speaking, you'll be able to put your hand up here, and I'll be able to then unmute you, and you'll be able to ask a question live on the webinar. Or if you're not happy about doing it live, you can pop it in a text in the question box here. And myself and Tricia will keep our eye on that question box and try and theme those. I doubt we'll be able to answer every single question that comes through, because I know that there'll be an awful lot, but we'll do our best to answer as many as possible, and we're absolutely committed that anything outstanding we'll pick up after the webinar. If you're on an iPad, it's a similar, there's an ask a question or a hand up there that you can use. If you've any issues or anything, pop them in the question box or the chat box and we'll pick up and try and help. So what to expect today? We're joined by some wonderful people. So we've got Martin Walker, who's a policy advisor at Think Local, Act Personal, TLAP, and he leads on self-directed support and has done for the last 3 years. But he's also been herding us cats together to try and get organised during the pandemic. So Martin will also talk about that. We've got fabulous Katie, who you might have seen on telly last night if you watched the BBC Two programme at 9 o'clock last night, and she's the Executive Director and co-founder of Bringing Us Together, which is a community for parents and of children and young people with a variety of special educational needs or who are disabled. And then we've got Rachel and David, both who work for Mark Bates Ltd, both extremely experienced. Rachel as a legal advisor, and David, who's been around, people will know him, I'm sure, who's been around for many, many years as an active member of the London Self-Directed Support Forum. So thank you all for coming, and we're going to start off. We've also got a special guest later on who I'll introduce, but we'll start off with Martin. Thanks, Martin.
Okay, I just check you can hear me, Julie?
Yes, yes, that's great.
Great. It's great to be here this morning and be part of the team that's presenting this webinar. Can we have the first couple of nip to the first slide? That's great, thanks. So thanks, Julie. So yeah, I work for Think Local Act Personal. Some of you may have heard of Think Local Act Personal, and at Think Local Act Personal, we realised very early on that the conversations that were happening in government about the things that needed to happen for the whole population around COVID was missing the voice of direct payment recipients and the people that support them, personal assistants. We recognised that very early. We had a number of opportunities to remind those folk that was the case. So people who work with us, and we have something called the National Co-Production Advisory Group, so a whole group of people with lived experience of social care, a good number of whom take a direct payment. Talking to ministers, MPs, and something called the All-Party Parliamentary Group, constantly reminding the system, if you like, that that voice wasn't being heard. And then we got the opportunity to actually sort of say that a little bit more formally and challenge and say, well, actually, it would be good, these documents that you're producing, it would be good to get the voice of people who actually need what they say for that guidance to be shaped. So the Department of Health and Social Care responded to that, and we've set up a direct payment reference group, and that is very well established now. We have a good route into government to so that voice can be heard, and I think so. There's that group. There's also a group who is convened by the local government association and directors of adult social services, sort of the big boys, if you like, in the sector, so we go along to that, and we also make sure, and that the voice of direct payment recipients is now being heard by these different groups who are doing work around the guidance that is produced and the thinking that needs to happen in terms of making sure the guidance makes sense to people on the ground. Can we go to the next slide, please, Julie? And these are the sorts of things we've been reminding that whole set of people about. What about direct payment recipients? What do they need? Their workforce. What about personal assistance? My mum herself actually is a self-funder, and you know, this is not all about local authority funded social care. There are lots of self-funders out there. We need to remember. We did realise as we were doing the work that actually there was a bit of a gap in terms of disabled children and their families, and so some of the guidance we ended, whilst our conversations largely were around adult social care, the work of certainly TLAP and a number of organisations, it is largely centred around adult social care. There was this gap around disabled children and families, so we've included and talked about those issues, and folk like Katie have brought brilliant experiences to bear in that conversation. And reminding, you know, it's felt like we've had to constantly remind the system, you know, there's a group of people here that need equal access and treatment on the same footing as other social care recipients. It seemed very easy for government to talk to the established social care sector and not so straightforward to talk to direct payment recipients and personal assistants. And as I said previously, getting the information tailored that is right for this for yourselves. So can we have the next slide, please? The sorts of things that we've seen as we've progressed, it seems to take a really long time. We have conversations, so you'll see later that we talk to government as a group about regular testing for personal assistance. And they'd already suggested that to us and come to the group early in December, and we've still not got an official position yet. And getting the direct payment guidance out seemed to take an inordinate length of time. We've seen lots of local variations. So before guidance comes out, all sorts of things happening. Some proactive local authorities getting on and doing a really good job. When the guidance is put in place, some local authorities, it feels like needing to be reminded, shall we say, positively, that the guidance exists and the sorts of actions that they should take, or the precise actions that they should take, in fact. They've needed to be reminded of those things. And then, but we have seen some movement, as I say, in the system. So the documents that we're going to highlight today are a good example that there at least was an attempt by the system, even not engaging with our group and sort of saying, what does it need to say? A recognition of direct payment recipients and personal assistants. Can we have the next slide, please?
Sorry to interrupt, Martin,
yeah,
sorry. I'm saying they lip read and ask you if they could actually see you while you're presenting as well.
Oh,
so perhaps
okay.
you could present.
Okay, right. Plan B. Okay, is that, there we are. Hello everyone. You can probably also hear my washing machine. It's decided to do a spin. Sorry about that. Okay, so in terms of getting onto the subject, so that's the background of the group, and what we're trying to do is make sure government really hears strongly the voice of direct payment recipients, the voice of personal assistants, and their specific needs in responding to to COVID. Can we have the next slide, please? So there's a couple of links to a document which is called the Standard Operating Procedure. So a document's been produced by the NHS, the Local Government Association, and the Association of Directors of Adult Social Services, largely because the coordination of the vaccination of social care, of the social care workforce, is becoming a responsibility. The coordination of it is been very much being a responsibility of local government, because there's so much social care delivered by the local authorities, I guess, is the reasoning for that. We've got some thoughts about that as a group. We've already talked to government about that, but a little bit more on that later. So within the guidance, there is this definition, some key things in this definition. All frontline social care workers directly working with people clinically vulnerable. So that's they're the clues there. They're not clues, very clear words. Social care workers directly working with people clinically vulnerable to COVID-19, irrespective of where they work. So this is language that's been framed, I think, to helpfully cover the whole social care workforce, and then the later part, whether they care for clinically vulnerable adults or children, or who they are employed by, give the scope in this definition for direct payments workforce, personal assistance, to be included in vaccination. This cohort, current cohorts, we're at number 2, and I will say, Mum 87 still not had a vaccine here in Doncaster yet, but we keep our fingers crossed. She's one of the decreasing percentage who haven't been vaccinated yet. So that is the key sort of description of who is entitled at this stage to vaccination in the defining the social care workforce. Helpfully in the guidance, next slide please. We do then see some words in the actual document which do describe personal assistance as example roles that are in scope, which is great to see in the document. It was put together really quickly, straight after Christmas, I guess, but we haven't yet at this moment had conversations with the system about the words that are in it, but I think it gives a good enough scope to make sure personal assistants are in scope for vaccination now. So next slide, please. And then there's this diagram, which is a little bit complicated, but basically it describes broadly across the country what should happen. And essentially, this says, number 1 on the left there, providers, employers identify eligible frontline social care worker. So direct payment recipients out there. So if you've got direct payment recipients on the call, if you've got PAs on the call, I'm sure we have, and all those support organisations. Employers identify eligible frontline social care workers, and then next box, they tell the local authority about them, basically. We're already seeing some variation in practice about how that happens, but essentially that's the key. And then the rest of this flowchart describes what should happen. So the person, the employer identifies, lets the local authority know about their PAs, the local authority compile records, they let the local health system know about those PAs, and then the local people charged with vaccination issue a letter inviting personal assistants to come for vaccination. Again, we're seeing some variations in the, and there are a variety of ways people can get that vaccination. You'll have heard of hospitals and GP practices, and then the big centres that are being set up. So essentially, your PA needs to get that letter, and they'll get the directions about how they book themselves in for vaccination, and then you can see the actual vaccination delivery part at the end there. The key bits, which we've been, actually asking for this and clarity about are personal assistants definitely classified as part of the social care workforce, and B, frontline social care workforce, and should be in category 2 for vaccination now, and B, how does it all work? We needed both those bits really to be clear, to be able to communicate some clear messages. Next slide, please, and I'm sure I've gone over 5 minutes. Just some links there. So the actual guidance document is there on the first link in this slide. The second slide is a really quite a good question and answers around the whole subject of getting vaccinated. And it is tailored to it says healthcare there, but actually it's health and social care. It's quite a good document. And we are seeing more stuff coming out daily, and we've got discussions with the local government association and the Association of Directors of Adult Social Services tomorrow, actually, to see if we can do any more to get clearer documentation out for you all. Next slide, please. I think I'm regular testing. So in terms of testing, at the moment, you should be able to get a test if you've got symptoms. There was also the offer of free antibody testing was made earlier in the year, and the guidance about that is out on the government's website. We've been really pushing quite hard to say when will regular testing be here for the personal assistant workforce. I can't confirm anything this morning. I think it's imminent. That's all I can say. I really hope that will happen. The home care workforce have that in place now. It's been built on from care homes, and there's definitely a desire within government to get it available to personal assistants as soon as possible. As I say, we've talked to the testing team already to let them know the sorts of issues that they need to take into account. Okay, so that's all from me in terms of what we know at the moment. But it's great to have Katie here. Katie, we've worked together quite a bit over the last 6 months, and I'm really pleased you're with us. Could you let us know about some real life experiences about what's kind of what people are experiencing at the moment?
That's great, Martin. Thank you. Yes, I'm really pleased to be here today on this webinar that was set up so quickly by Be Human and in Control, and talking about these hugely important conversations around PAs and vaccinations. So I'm the proud mum of Nadia, who's observing today behind Katrina. And Nadia's a direct payment user, and she's been a wonderful teacher to me on how to be a good employer. I'm also really proud of our team of PAs who stuck by with us during the pandemic, and are really pleased that 2 of the PAs, Katrina and Steph, are part of the team today and are doing the interpreting. And you can see how valuable and how expert and skilled our PA team is. When Nadia was 3 years old, I attended a conference on inclusion where I learnt about the social model of disability and the independent living movement from those who were part of the disabled people's movement, some of whom were on the brilliant programme Silenced, which was shown on BBC 2 last night. In 1998, we moved 100 miles to Calderdale to get Nadia into a mainstream school, and she became one of the youngest recipients of direct payments in our area. She now runs her own team with the support of Katrina, who's a key player and is the coordinator. And we try to take more of a backseat, although we still do the nights. I still get worried and anxious and stressed, and we are the backup team, which has been needed a great deal during COVID for obvious reasons. We also do the payroll. Having choice and control is much easier said than done. And all of you that are listening now will really be able to relate to that. Having direct payments is a bit of a roller coaster. And we've had our fair share of adventures, ups and downs and stress. But the difference that it has made cannot ever be underestimated. As a family, we've been shielding since March, and we still are wiping down parcels, shopping and being ultra careful. Nadia caught swine flu 11.5 years ago and was on life support for 3 weeks. We've seen the damage a virus can do that swept through her body at a rapid rate. During the pandemic, bringing us together has run regular Zoom workshops, and we've listened to the experiences of hundreds of family members. In the first 2 lockdowns, we held direct payment peer support sessions, attended by young disabled people, disabled adults, founders of the Disabled People's Movement and family members. And this fed into the National Direct Payment Advisory Group, coordinated by Martin. The voice of users of direct payments was influential in the guidance that then the rest of us were able to share widely through our networks. And the group has also raised the profile at government level of the work of personal assistants and their true worth alongside key workers and essential workers. The biggest challenge has been how to get that information out to local authorities, and more importantly, getting it out to all the thousands of people who, for many reasons, aren't on social media and don't have direct contact with their local direct payment teams. At the same time, I've been part of a local group set up by Calderdale Council that was attended by, and still goes, by adult social care, direct payments team, disabled people and disabled-led organisations. It's called our COVID-19 advisory group. And Calderdale direct payments team have been on the ball with getting PP out to direct payment users, testing, and now the vaccinations. They were also really flexible on how we spend the money, which meant we were able to pay family members for the first 4 months of lockdown rather than bring PAs into the family home. Nadia began to bring PAs back through a risk assessment process in August, and we've also been able to recruit new staff. It was last Monday when we knew that PAs were in the cohort 2 for the vaccine. So I called the GP straight away and was told by the receptionist that they'd run out of vaccines, they'd got no idea when more were arriving, and they hadn't finished doing the over 80s. So Nadia and Katrina contacted the direct payments team to ask and do it that way. They promptly sent her an email back specifically to register the personal assistants for the vaccine. And within a few hours, she was able to book an appointment for those who wanted the vaccine. And those PAs have now been vaccinated via the hospital. The other members of the team are currently not wishing to have the vaccine at this time for various different reasons. And Calderdale are currently working out how to get PAs regular testing and packs out to direct payment users, and it's a logistical nightmare. We'll be using the regular testing. We've got a delivery. That always happens, doesn't it? We'll be using the regular testing for the PAs not vaccinated. And from listening to people on social media, we know that the process differs greatly. To give you some examples of the difference in where you live makes, one direct payment user has said that to get the vaccine, you do it through the GP with a letter from you referring to social worker and/or continuing healthcare as applicable, confirming that they're frontline health and social care workers. Whereas in a different area, the direct payment user said, if they're on your direct payment payroll, you, the care manager, social services, are responsible for identifying them as a community care worker. One person told us that we have a PA who has a vaccine appointment next Friday, and they proactively contacted our primary care network site and booked online. In one city in South Yorkshire, it's been fed back on Twitter. When asked if they were vaccinating the PAs, the response was they would be vaccinating physician associates, not personal assistants, as part of their frontline team. And in Wales, one person told us this: coronavirus vaccine, all my PAs now have been asked to book their vaccine. One has already had it, so the vaccine programme is working here. I hope it's working everywhere else. Other people have got no information. Somebody said no news on mine, and somebody else said we have had no news at all. The GP surgery just kept telling people not to phone about appointments, and social services says they have no information about how to get PAs vaccinated and let us know when they do. It feels like a brick wall. The over 80s we know in the village have been vaccinated, but don't know when their second appointment is or if it's going to be cancelled. So I, for one, are really looking forward to hearing from David and Rachel, and really also interested in the questions that you're going to be asking and getting some answers. And thanks so much for inviting me.
Thanks, Katie. Thank you very much. Hello, everyone. My name's David Ashley. I'm here from Mark Bates Ltd with Rachel Harkin, who is also here from Mark Bates Ltd, but also Independent Living Group, ILG Support. I will explain precisely who that is very briefly. So Mark Bates Ltd, for those that don't know, we are an insurer of individual employers. So if you employ a personal assistant, you need to have employer's liability insurance, and Mark Bates Ltd are a leading supplier of employer's liability insurance. Now, part of our policies, we provide, whatever level of cover you have, is access to legal advice, and advice for all of the issues related to you being an employer. We have traditionally contracted that service out, but I'm quite excited to say that as from January this year, we've launched a new service, ILG Support. And ILG Support are all about taking employment law and translating it as clearly as possible into the world of individual employers. So recognising our policyholders, recognising the demographic, and making sure that we're translating that information and being as supportive as we possibly can. Part of that is involved both from Mark Bates Ltd, but increasingly from the ILG Support and our involvement in kind of training. We do lots of training for direct payment recipients, and also our involvement in the group Martin has coordinated so well with other partners such as In Control and everything you've heard about this morning. So we're really proud to have been part of that. And during the pandemic, we worked really hard to put guidance together, which I'm sure many of you have seen. And we have been asked about revising those guidance, which is something we're working very hard in the background to do. The latest guidance note, advice note we sent out, ILG Support, last week was about vaccinations, was about what to do if my personal assistant doesn't want a vaccination. We've since revised it, and here's a copy of it there. This will be made available. I think there'll be a link to it underneath the Be Human site, and it will be sent out to anyone who's attending today. So that's what we're going to talk about. Rachel's here. She heads up ILG Support. Rachel knows more about employment law than anybody I've ever spoken to. She's certainly the person I go to for questions, and is extremely knowledgeable and has a history of advising individual employers. So Rachel, hi.
Hi.
And Rachel, would you mind just starting our bit here by kind of summarising perhaps just a bit of history on vaccinations, maybe from employment law perspective, a legal perspective, specifically around potentially kind of mandatory vaccinations, if that's okay?
Yes. I thought, well, before we start talking about the very specifics of individual employers, it would be worth giving you a bit of a brief introduction to some of the key points of law that impact on this issue. So between 1840 and 1898, the government actually mandated vaccinations across the whole of the public. Come 1898, vaccinations were argued to be against civil liberties, and so at that point the law changed. And this is a recognition of individuals having their autonomy, having their right to their own bodily integrity. So now we find ourselves in a position where the government cannot mandate that anybody has a vaccination. And in order to undertake that medical intervention, there must be consent. If you try to impose that vaccination on an individual without their consent, it is actually a criminal offence. So with the exclusion of very few exceptions, even the government cannot force us to take the vaccinations. So why is this? It essentially comes down to an ethical discussion as to the fundamental civil liberties that an individual has. Under the Human Rights Act, Article 8, we have the respect for a private and family life, and that includes an individual's bodily integrity. So I think it's very, very important to remember that this ethically centric concept of an individual's right to do with their body as they wish has to remain at the forefront of our minds when we then think about the potential to mandate a vaccination on any employee. So some other key points of law we might need to consider as an employer. First of all, we have the Health and Safety at Work Act 1974. That requires that an employer takes reasonable steps to reduce the risk of harm to their employees. There is also a common law obligation on an employer to maintain a duty of care to their employees. So many employers will have already had advice through the times of COVID to make sure they are carrying out thorough risk assessments and that they are putting in place any measures they can to keep their employees safe. When we think about managing employees and their actual activities in carrying out the work, we can be mindful that employees have an implied duty to follow the lawful and reasonable instructions of an employer. Now, in order for an instruction to be reasonable, it's got to also be proportionate. So this is one of the key concepts that we'll be considering when we think about mandating a vaccine on employees. Some employers, rather than go down the route of simply saying you are failing to carry out reasonable instructions, some employers are thinking about changing terms and conditions of the employees. So in order for that to happen, the employer would have to consult with the employee. There has to be that two-way conversation. The employee would need to agree to any changes to their terms and conditions of employment. I would advise any employer who's thinking about going down that road to keep in mind not just what that means is in the process, the consultation and the discussion that needs to happen now, but also think long term. Perhaps think about a COVID-19 policy. How long are they going to ensure that this policy is in place? Is there going to come a point where perhaps the numbers reduce in society, so perhaps they will change their mind at a future date? Are they going to start encouraging additional vaccines such as the flu jab and so on? It's important to think on a grander scale, not just about this one incident now, but also what that means long term for their workplace. Some employers are considering where they perhaps can't get an agreement from their worker, or they can't get their worker to follow what they consider to be their reasonable instructions. Some employers are considering a dismissal. I wanted to just highlight a couple of points as to how somebody succeeds in an unfair dismissal case. The first question is really going to be, does this dismissal fall within the band of reasonable responses to the alleged breach on the part of the employee? So we need to be able to see that the employer has a really obvious belief that the employee has breached an important instruction and that that is based on reasonable grounds. But in addition to this, I want to highlight at this stage, if any employer is considering a dismissal, it is so important that the right process is followed, because a fair dismissal is not just about the reasoning, but it also requires an assessment of whether or not the process has been fair. And essentially, that process follows ACAS guidance, it follows the a process of talking to the employee, giving the employee an opportunity to explain themselves, perhaps defend themselves against allegations that they have done wrong, and make sure that we can demonstrate at the end of all of that the employer is still in a justified position to go ahead with the dismissal. So I really need to stress to you how important it is that an employer doesn't just simply listen to the contents of this webinar, that they actually take individual advice and make sure to follow a fair process. In all of this, it's also important to note that data protection is a very, very important concept in the employment relationship. An employer is responsible to ensure they are protecting an employee's data, and anything to do with their health, with any medical interventions that they may or may not have had, is sensitive personal data. So an employer needs to perhaps consider updating any data policies they might have in place, but they also need to make sure that they're not sharing this information with anybody who it's inappropriate to, spreading information around the team. Perhaps if you have some PAs who are keen on getting the vaccine and maybe others who aren't, we need to protect the interests of each individual and their beliefs with regards to their sensitive personal data. And then the final key legal principle we need to remember comes from the provisions of the Equality Act. And that means that when an employee is suffering with any, has a protected characteristic. There are all sorts of protected characteristics, but there are three key ones that come up in the context of a vaccine. Some are arguing that they are pregnant or are planning to have a baby, and so in insisting on a vaccine, it might cause them problems. They have been advised not to just yet. Some are arguing it on religious beliefs, and some are arguing it on the basis that they themselves have a long-term health condition and they fear any potential negative consequences that might happen from the vaccination. So we have to be very, very aware of anybody who is not simply saying, I don't want to have the vaccination based on political grounds or something that they've read on social media, but actually if their reasoning comes from the point of view of them themselves having a protected characteristic, we need to make sure that we're not applying a provision, a criterion or practice that indirectly discriminates against them. So that's a key area that I would ask any employer to be hypervigilant about, really. Now, don't get me wrong, as we've seen with the implied instructions, this implied duty to follow reasonable instructions, there is a question of proportionality, even where we have an employee who has one of these protected characteristics. And a defense is available for an employer if we can show that there is an objective justification. So that would require the employer to say that the provision or the practice and the policy that they have put in place is a proportionate means of achieving a genuinely legitimate aim. So it is possible within the scope of employment law that we can mandate vaccinations in certain circumstances if we can show that there is proportionality applied.
Great, thank you, Rachel. That's a fantastic overview. So a couple of practical questions, if I may. So what would the response be if one of our policyholders was to call this morning, which I know some have, and ask if, can I make vaccinations mandatory? How would that question be kind of responded to, you know, on a practical level?
Okay.
Let's imagine that perhaps an employer who is clinically extremely vulnerable and perhaps one that isn't, what the practical response might be, just to give people, to bring it back to their kind of reality and their experience.
Of course. So the first step that we would take is to ask the question of whether or not the employee is objecting on a ground that they have a protected characteristic. Indirect discrimination is something that we would like to avoid. So, and it carries its own legal remedy. So we need to be very, very vigilant to that. So I'd be exploring the detail of that. Another question we would ask is, how long has an employee actually been working for you? Because on a general basis, an employee doesn't have the right to bring a claim of unfair dismissal unless they have been employed for 2 years. So if an employer is thinking along the lines of a dismissal, it may be that any employees who are under 2 years service, it's actually a little easier to go ahead with the dismissal. You're running less risk of a legal remedy later on down the line. So it's an important factor for us as advisors to understand. But then we start to tap into this question of, is this a proportionate instruction that we're giving to the employees? So I would be exploring, as you say, you know, what is the situation of the employer? Are they somebody who perhaps falls in that very the CEV category, that they themselves are extremely vulnerable to the risk of COVID, and so any contact with somebody who is carrying the virus would actually put their health at extreme risk? That is a very, very important factor for us to understand. Now, of course, not all individuals that call us, not all individual employers that call us are in that very vulnerable category. People have direct payments and personal health budgets for very different reasons. So if somebody is perhaps less vulnerable, that is a factor to take into account. But along with all of that, we'd also be considering what measures the employer has already put in place. So that goes back to this question of the Health and Safety Act. What has the employer done so far to assess the risk to everybody in the household as well as the employees? What measures have they already put in place? Are they maintaining social distancing? Are they using PPE? Are they ensuring that everyone within the household, as well as anybody outside, anybody who might be coming in, are following COVID rules? So a really thorough understanding for us as to what that working relationship is and how many individuals they employ. It's all going to be very, very important for us to help them assess whether or not they can mandate the vaccine. And of course, the final point really is to say it's so important that we take into account the employees' views. Going back to the original point I made, this is a question of their civil liberties. This is a question of their bodily integrity. So we need to understand what is the basis of their objection. Is it something to do with that? Are they concerned about risks? In which case it may well be that an employer can help to educate and guide and maybe correct any misunderstandings that an employee might have about the risks. Or is it something more fundamental? The employees' views are so important, and we would balance that in the round and help the employer to come to a decision that was right for them and that kept them and their employees safe. I want to sort of add that it's easy to perhaps listen to the content of a webinar, read something on a website, and feel a little daunted by the idea of taking legal advice. And I think it's important to encourage people to communicate with us. At ILG Support, the individuals who are helping to guide our individual employers have a thorough understanding of their situation, and we will help to take an employer through the process step by step and really give some peace of mind. We don't want to feel that it's a very daunting process to go through.
Brilliant, thanks, Rachel. And just to add, presumably you'll look at the PA's role as well, because obviously one PA maybe in personal care, one may not, and you'll balance that as part of that kind of balanced process. That's fantastically helpful. So let's imagine then a scenario if somebody didn't take advice, they did mandate the vaccination or said, you know, actually I'm going to dismiss you for not taking the vaccine, they didn't seek advice. What are, briefly, if you will, I'm conscious of time, what are the potential consequences of getting that wrong?
Okay, so from a legal remedy perspective, there are two key remedies that an employee is likely to seek. One is unfair dismissal. That's the obvious example. So an unfair dismissal is broken down into two elements. The first is a basic award. The basic award is made up of it's like a statutory redundancy payment. So it relates to the employee's age and how long they have been employed for. So that's the sort of initial amount that can be claimed because they have faced that civil wrong. The second is a compensation award, which is very specifically it's connected with how much they have actually lost because they've suffered that wrong. So if it took them 3 months to be able to get another job, then they would claim 3 months worth of loss of earnings, for example. So the compensatory award looks very specifically at the individual's financial losses. It is worth noting that at the moment there is a considerable backlog in claims in both the civil courts and the employment tribunals. So it's quite possible that it would take a very long time before an employer would actually be facing tribunal proceedings if it came to that. The second element, if it is relevant, would be a compensation amount for the discrimination if they felt they had suffered discrimination on grounds of a protected characteristic. That is an uncapped compensation amount, whereas unfair dismissal is capped at a year's salary and no more. Discrimination claims are uncapped. It is likely in a situation like this it would fall under the lower level vento bands, which is anything between £900 and £9,000 for the isolated incident.
Brilliant, thank you, Rachel. I should add at this point, obviously, this is the reason legal advice and legal expenses are included within policies, insurance policies for direct payment recipients. All Mark Bates Ltd policy holders, plus or deluxe level, will have access to legal expense compensation awards. Other insurers are available, I should say, in interest of balance, and they will have similar legal advice, legal expense cover in their policy, and different organisations providing their support. So I think the critical message for everybody is listen to what, if you're listening to what Rachel's saying, is do seek advice, do ask the question before acting, and be confident of your decision, and explore how that balance is looking for you, particularly in regards to vaccination. So I think my last question, Rachel, really, I think what I'm interested in, I'm sure many people are, is there a difference? And could you explain the difference if you're recruiting a new PA? I think we've spoken kind of implicitly about our existing personal assistants at this stage. What about if I'm recruiting somebody new? Can I insist they have the vaccine or are willing to be vaccinated? Can I put it in the contract from the start, and does that make a difference?
It does make a difference. I would still start by asking if the PA or the applicant had a concern about the vaccine on grounds of a protected characteristic. We would want to protect them against any discrimination claims, because an employer can face discrimination claims from even a recruit, somebody who is not yet an employee. So it would be important to question that. But otherwise, what we're talking about now is imposing a term of the employment that the applicant has the right to either choose, accept, or reject. If they reject it, they don't have to take the job. So this is a very different setup, because at this point we're discussing terms being implemented for an arrangement that's brand new, rather than trying to override rights that are already in existence.
Brilliant, thank you. And just going off script slightly, because something's just popped into my head, which I just want to ask you now. Really, really quickly, guys. So it is, if I have casual workers, a bank of casual workers, 0 hours contracts, 3 of those people are willing to have the vaccine, 1 of them is not, am I okay to stop asking the one who isn't to come in and just focus on the 3 that are? Is there any kind of issue with that? I know, sorry, I put you on the spot. So,
no, that's fine. It's an interesting question. Again, I would say be very wary of protected characteristics, because what we don't want to happen, regardless of what their employment status is, we don't want to see that an employer is identifying and singling out somebody who has a protected characteristic. So always one of the key things to check. But otherwise, really, their employment status is irrelevant. I think we need to be making sure that everybody is approached in the same way. I'm always cautious of assuming that anybody is simply on a 0 hours or genuinely casual basis, because often we find that whilst they've been given that kind of contract, actually they've had very, very regular work coming from that employer. So I would like to caution against an assumption that they're casual, but in theory, after a casual worker has completed a particular shift, or however the contract is constructed, when they come to an end of a period of assignment, that contract has severed. So in theory, it may be possible for you to say, if you're not being vaccinated, I'm not going to offer you further work.
Brilliant. Thank you, Rachel. That's fantastic. I think that kind of wraps up our bit, although I was going to make an indirect payments joke about moving on to talk about employment status, which I'm sure everyone would have been excited about. We're not going to do that. So I think, yeah, that's us. As I say, the guidance, which is on the slide there, is available. I hope it's useful to people, and I hope what Rachel, thank you so much. And I hope what we've had to kind of talk about today has been of use. Thanks, Julie.
Brilliant. Thank you ever so much. So I'm going to move on now to a surprise guest. So we're really thankful, John, that you've attended this webinar. So John is a disability rights, independent living, diversity leader in the UK. Some of you might have caught him on the television programme last night that Katie was talking about. John was one of the first persons to set up an independent living scheme in the UK with funding to organise his own personal assistance. So he's our hero of personal budgets and direct payments. And more recently, he's been actively engaged with the independent living movement for both the UK and the Europe since they started, since the beginnings, really. So John, you're going to tell us a little bit about what's been happening locally for you and start us off with some questions.
Yes, well, first of all, good morning, everybody. It's really, I'm really pleased to be able to talk to you all here today. And first of all, I'd like to just put some background to this before I go into telling you what I'm doing on a local level. I mean, we've been through an incredible year. Well, it's almost a year. It's, you know, it started about 10 months ago. And when it started, I would put it, you know, I have 37 years experience of living independently and employing my own PAs through direct payments or more currently through a personal health budget. And before the government made the announcement to lock down last March, already myself and my PAs had discussed this and agreed together with my wife that we would self-isolate, that we would take precautions. We didn't want to wait any longer because we knew the situation was quite serious and pretty much was going to get worse, which we did do. I think I'm very lucky in that I have a very good team of PAs, and one of whom has been with me almost over 6 years. Another has almost been with me for 5 years, and my wife as well. So we have quite a tight sort of group of people. So I was fortunate from that respect in having a good start. But you know, we knew we had to increase hygiene standards and everything else and be absolutely cautious. And I did not want my wife or my PAs to do shopping for us or go into any of the shops. So I organized that through home deliveries and everything. But anyway, coming to the point of what we're talking about here today, about vaccinations and also testing. I've felt very strongly for some time now that it seemed pointless, me just getting a vaccination, because what was the point of that? You know, if my PAs would contract the virus, which hopefully they won't, then that would leave me in a very difficult position, in that, you know, it's not an easy time to employ people right now because of the situation, and because we have to be very careful. And we decided that you know, we would stick together. And I felt that this needed to be addressed really a long time ago, and it's only now that we're looking at it. And I think it was only 3 weeks ago that the Department of Health and Social Care actually confirmed that PAs would come into category 2 priority, which is the same as health workers and care workers in care homes and people working in the community, which was great news. And then this was backed up by the NHS England saying that what was important, that we had to ensure that our PAs were registered with their GP surgeries, so they would be on the list for the vaccinations. And Martin has quite clearly earlier on in his presentation sort of outlined that process. But we still have a long way to go. I mean, we're not seeing it. I personally would like to have seen testing available to PAs, in every local community, but we haven't got there yet. We're still trying to establish that. I would like to see a seamless situation where we could do this locally all around the country in local hubs. But Martin has talked about this, but we still have yet to achieve it. I mean, I've been fortunate in the sense that I've been working now with an organization called the Social Care Institute for Excellence. And we have been looking at this. And also we've been working quite closely together with TLAP, Think Local Act Personal, where Martin is from. And also Katie, who was part of their co-production group. And just after the whole pandemic started to get worse, in April already, the Department of Health approached us to do some work at pace very quickly to draw up some priority guidelines around COVID on various social care issues, stuff around care homes, PAs in the community, and lots of others. But, like the Department of Health, they wanted it straight away. They wanted it, like tomorrow, which was crazy. But anyway, there is now available, which can be found out on the Social Care Institute Excellence website, or all the papers that were put together on a local level. Also, we put together an organization about 10 years ago called PEP, which stands for Personal Expert Panel. And that is a co-production group, because we did think things needed pepping up then. We needed to agitate to make sure sort of we were going to make some advances together. And we have, over the last 10 years, worked quite closely together with Hampshire County Council, with the adult health and social care team. And more recently, over the last few years, we've also, something we wanted to do for a long time, started working much closer together with health, with the local CCG, with the community healthcare team. And we do have a co-production group that meets every month regularly. So we are now, seriously looking at this issue around testing and vaccination and trying to push it forward in this area. And already letters have gone out to all personal health budget holders, explaining to them the situation about how the hub works locally and that they need to be registered and so on. But, I'm still, very, very keen that things need to happen. Until now, I know only of one other person who has a similar impairment like myself, or somebody who is at extreme risk, who's had it. And I've only known of one PA, and I think the situation around the country is very, very patchy. And, I think we're lucky in the sense around in Hampshire that we are at least working together with the CCG and the community healthcare team, and also with the adult health and social care, because that's the way forward. I mean, without our partnership working, I don't think we would be able to make any progress. But we really have to try and push forward now and pull out all the stops. And we will continue to meet regularly. But I would like to see within a month a lot more colleagues and other direct payments users and employers and personal assistants being vaccinated. And in the meantime, somehow or other, we've really got to get this testing available. I would like to have regular testing for my PAs, so we could keep on top of the situation. We have until now been very, very lucky. And I think that's only because we have a tight team and everybody is taking the rules seriously and, you know, doing what they should be doing, which sadly is not always the case in local communities. But my advice really to everybody who was on this webinar is to try and encourage local working together with, you know, user organizations and local authorities and CCGs, so that the whole situation can move forward. It is very strong in my heart, and I mean, I wouldn't sit back and let things happen, because they don't happen otherwise. Unless you instigate things, you have to make those things happen. And I'm very conscious that time is going on, and I've been asked to start off a series of questions. We've had some amazing questions coming in the last few days. And so my first question really to the panel is, first of all, what would somebody like myself or a family member who had, like Katie, who had a child with an impairment, what if they lived in an area where there was no local support like what I've talked about, what would they do? The second question I would ask is, we've been reading and hearing about the devastating consequences that have happened over the last 10 months about the mental state and well-being of people. People are struggling mentally, and what is the best way of trying to support those people with mental health issues and problems in the future, because it is quite a serious situation. And last but not least, question that has been touched upon by the legal advisors from Mark Bates is about what can be done about PAs who don't want to be vaccinated, because some either fear it, some are afraid of it, some are also have health reasons that they don't want to go ahead with it. And unfortunately, some of the messages now going around social media platforms is about conspiracy theories and stuff like that, because I know friends and colleagues who work in the hospitals, and there are many nurses, I've been told, who do not want to have the vaccination because of these conspiracy theories that are around, that people, you know, really do sort of fall for. So we need to somehow make sure that we can push forward with the vaccinations. I think I'm going to stop there, so we can open the questions up, and I'll pass it over to Julie and try and organise this.
Brilliant. Thank you, John. Martin, can I come to you first then on the issue of, you know, what if you're in a situation where you're living in an area where you don't have a local group or local access to support, and what are the different ways of gaining support? So certainly, you know, I can talk about the Be Human and In Control that's offering some support through the National Register, and we can send that link out to people. But anything further from you, Martin?
Yeah, I was gonna just mention that'd be great if you could get your links out, Julie. There's no, it seems to me, peer support, you know, in terms of addressing those mental health issues, you know, people helping people talking about these things seems to be the one of the best ways of getting really good support around helping people with their mental health at these times. We've got some great examples of what people have done on TLAP's website, actually. So it comes with COVID-19 social care provision, stories of promise. And there's a strong flavour in a lot of those about, again, local groups, but some groups that are condition specific, that are national groups that have online and virtual networks. There's a really strong flavour of using online, but that's not for everybody, is it? So telephone as well. So there's a good smattering of things that people have done, so people can have a look at that. I am aware some local. Sorry.
No, sorry, thanks.
Sorry.
Can you turn your video on so people can see you?
Oh yeah, sorry. There we are. Sorry. Yeah. Fortunately, there are some commissioned personal assistant support networks. I know in Doncaster, actually, the Disabled People's local organisation fought for that with the council, and that's a commission service. And I think also in West Sussex, Independent Lives, I think have got a similar sort of service, but they're pretty rare. So this might be an opportunity for actually people to sort of mobilise and how do we connect together better as direct payment recipients, personal assistants. There's probably a stronger flavour of that for direct payment recipients connecting together virtually and talking about these things than for personal assistants. But it's about to be a really good time, you know, and simple stuff using social media, you know, Facebook groups, Twitter. I don't know about Twitter, maybe Facebook closed groups.
Yeah, and I suppose people Mark Bates from insurance would know a lot of employers as well who perhaps weren't connected, and whether or not we can start actioning something around sending it out to some of the insurance companies so that people can start getting a link to. Brilliant. Can I come back to you then, Rachel and David, around these conspiracy theories? And, you know, you sort of took us through the legal process of, you know, what you could do and what would happen if you dismiss somebody or what, but just generally, is there anything out there that's just generally on education for people?
My understanding is that there's some very good information been provided by the government online. I think the NHS have provided some really useful tools. One of the things I'd like to highlight is that if anybody is struggling to access online services or education that might be available online, do get in touch with us. We will help to provide that information, maybe print it, whatever we can do. We would like to help support an employer to have that good communication with their employee and maybe help educate and inform better decisions.
Yeah, and just to add to that, Gillian, in answer to your point, yeah, we'll be happy and delighted to send information out to all of our many kind of employers we insure. We do send out regular newsletters. We're you know, through our engagement with you guys, our groups, TLAP, we're all willing and ready to get information out in a timely fashion wherever we can help.
That's great, thank you. Tricia, can I come to you to what's in the question box, and then I'll start looking for people's hands up.
Yeah, absolutely. We've got a ton of questions and I'm trying to theme them, and I just want to, I'll do the broad-based ones first and then we'll see how many specific ones we can get through. So I think the first two, there's been lots about these, the first one. So the first one I want to pick up is informal carers. So we've talked a lot about paid PAs, but there's been several questions about people who are registered with their GPs as informal family carers, particularly people who are older family carers who are doing the work of PAs because of their paid PAs not being able to work because it's their, you know, their shielding or the person shielding, and so very different experience, but a lot of experience of being told you're not eligible for vaccines. So I just wondered if anybody would pick that one up. I'm not sure if that's a Martin one perhaps, or Katie.
Yeah, I'm happy to jump in. Tricia could tell you what we know. Carers UK definitely are raising this issue at the government level, and sort of really challenging because unpaid carers, first of all, didn't appear in the documents, so prominent people like Philip Russell, similar to John, you know, in that sort of unpaid carers movement that are well connected to government, are really pushing for clarity on this. As I understand, unpaid carers are in category 6, which is much later down the sort of vaccination order, so it won't be some time. But so there is movement, and there is campaigning going on to try and see if we can raise them up. And I guess the other thing that they've said back is that we do know it's not ideal in terms of family carers of younger disabled people, but lots of carers are carers of are themselves over 50, so they will probably get vaccinated within the first cohorts, or yeah, older people anyway.
And there's a bit of a follow-on to that, I think, in that just to clarify that it's all PAs. The guidance seems, it's about whether the guidance says that anybody who's a PA can get the vaccine in tier 2, in level 2, or whether it's just people who are PAs to clinically vulnerable people. So for a couple of people,
I think this is one of the things we want to pick up with the LGA and ADAS tomorrow, because I personally don't think that bit's very clear. And it seems to switch around. Yeah, so I think we need to pick that up and clarify it if we can.
So particular arguments around people living with mental health issues, or people supporting autistic people who are not, and that's my situation as well, in that my kids are not clinically vulnerable, but they are vulnerable in other ways to the system that aren't about their health. So, and I guess anything that we find out and clarify, we'll make sure we get that information out widely.
Yeah.
Okay.
Yeah. I suppose just the thing there, Tricia, about unpaid carers is that some unpaid carers have actually gone forward and said, I'm a personal assistant, because they are, even though they're unpaid. So they've used the guidance that quotes personal assistance and said, well, that's what I am. Whether I'm paid or not is irrelevant, actually. So it's just, I think it's just one of them things that's just worth knowing for people as well sometimes.
Yeah.
And I think this comes up to another point that's come up lots from people, is the huge variation. Katie talked about it, is, you know, people's different relationships with their GP. Some GPs, if you've said that, will be absolutely supportive and say, yes, of course you are. Some are not going to be so supportive. Rogue cat, everybody has a rogue cat on webinars, don't they? You know, so I think it's always worth, we have a good Geordie saying, shy bands getting out. So there's something about it's always worth trying to talk to somebody and say, I am a PA, so it's always worth doing that. And that leads on to the other thing that there's been the most questions about, and I know, Martin, you talked us through this beautifully at the beginning, but if we just have a bit of a run through again. So that idea about, okay, who do I contact the local authority? Who is it? Is it my social worker? If I need to be registered, if my PAs need to, or I'm a self-employed PA and I need to be registered, who do I talk to? What about this personal health budget? What about if I'm privately funding people? So that idea about lots of people saying, well, I went to my GP and they said, go to the local authority telling me I've got to go to my GP. You know, can we just talk through one more time that what is the process of getting PAs registered? That'd be really helpful.
So the guidance that's out, the standard operating procedure says it's the employer's responsibility to contact the local authority, whether or not they're self-funded, it's a self-funded arrangement, self-employed, or a personal assistant employed by an individual employer. The employer needs to contact the local authority. There will be local arrangements for that. I know that they've gone for an electronic approach to that, so it's register here, and locally, local authorities are getting information about what needs to happen out in different ways. We've seen some positive practice that, as John described, disabled people's organisations, commission direct payment support services, working really well in partnership with local authorities to get information out as broadly as possible, as widely as possible. You need to find out what your local arrangements are. In simple terms, phone the council and be determined on the phone, I employ a personal assistant, I need to get them registered on the council's standard number. You should end up with the right team, but actually we are seeing examples of councils getting out information specifically. This is what you need to do. So you need to look for your local arrangements. Is that clear, Trish?
I know it's hard, isn't it? And I just wanted to answer a very specific question. Someone said, if I'm getting PPE, can I assume the council knows I've got PPE? I would say no. Again, just register, just know.
Yeah.
Never assume anything, definitely not.
Yeah.
There are other things that are coming up about local variations, but I just thought it might be helpful. I think this might be something you might come up with, might help with, Katie. Things like I'm having to do COVID tests I'm having to come in to do COVID tests for for several workers, that means I have to work an extra hour. Can I put that extra? Can I claim those extra hours? What about people who are not having, like you did, Katie, for a while, not using their PAs because they don't? It's just not the right situation for them to be doing that, but they're paying themselves. What things come under COVID expenses? And has anybody made a list of things that could be seen as COVID expenses? I don't know if that was something you did at all, Katie. I know it will be locally based, but I just thought it might be helpful. And the other thing about any good stories you've got about particularly getting lateral flow tests. We've had a couple of people saying they want to be able to get the lateral flow test for the quick results because people are waiting an awful long time to get results back. So is any of those you've got some nice tips about, Katie?
The lateral flow tests that are meeting on Monday with Calderdale Council, and as Marty says, and also John said, it's really important to have that relationship with disabled people and organisations and working through all this, because it's really, really complicated. And as our direct payments team does say, it is a logistical nightmare doing this. You know, they don't have all the answers. The guidance is there, but it's so varied what's happening on the ground. So our local area on Monday told us that at our local fire station, which is a testing centre, they're going to be having lateral flow tests available to all PA employers. But that means that you're going to have to drive, and if you're shielding, that's extra difficult, to the centre to pick up your home tests to then be able to take home. Each PA then does the test and then sends it back or delivers it back to the fire station. So they know that isn't going to work, and that's really complicated. So they're trying to work out, the direct payments team, with Locala, who are our health people at the moment, and try and work that out. Do they post them out? But who has that capacity to post them out? So it's like work in progress. But the more that you ask, and I think that's so good, Tricia, what you said, you know, the more you're asking these questions and highlighting them. And then you said something about the payments to get tested. I think that's a really good question. And I think that's how it's a conversation to be having with your PAs. There may be something legal that David or Rachel has, but we, for instance, that would be great to have that conversation with our PAs. And if they are going for a test and it takes them an hour there and an hour back, we would have that discussion. And if they were going to, Katrina's sitting there listening, so she's going to put an extra hour on her timesheet, but you know, I think that would be absolutely a positive thing to do to continue that relationship. A lot of this is about communication as well, and conversations and being open, not too emotional as a PA employer. I think we've had some really good guidance from Rachel and David as well that's been helpful for us.
And just that specific one about COVID expenses, do you know anybody who's got a list of the sorts of things or have done any work on the sorts of things that we've been putting through as COVID expenses? It will be, as I said, it will be local. I know it will be, but I just wondered if you knew anybody who'd done that.
I don't, but I think that's, yeah, it's a really interesting thing. I can ask that. I know, for instance, we have put Zoom on our expenses and a laptop because we needed that for Zoom. So I think it varies, and of course, our two family members. So it's creative ways. We've talked a little bit about this in the reference group. The thing for me, my advice for what it's worth would be, if it feels like a valid expense to you because it is helping your life, then actually it's a valid expense and you make a good case for it. So because there isn't a rule, there isn't a national rule about what is a COVID expense. So if it's valid for you, then it should be. We've got
yes. Thanks, Tricia. Can I just take a couple of live ones, because I know we've only probably got about 10 minutes left. So I just know there's a couple of people with their hand up, so I just want to give at least a couple an opportunity to come on live. So Ben, I'm going to come to you. So Ben, can you hear us? Hi Ben. No, I think we've lost Ben. Okay, I'll come to the next one with the hand up, which is Esther.
So, can you hear me?
So what's your question?
Okay, I actually have two questions, but they are relatively quick. So question one was for Martin. I just wanted to understand what input there had been from PHB holders in the national work that you've been doing, because they have a very kind of specific requirement around health and wellbeing needs. And the other question was for Rachel, which was, is there going to be any specific guidelines developed for PHB holders, because they're not just clinically extremely vulnerable clients, they're also clients who potentially have invasive, high risk delegated healthcare tasks as part of their care. So that there's a higher level of risk with infection management and control.
Brilliant questions. Martin, can we come to you first?
Yes, that's fine. So what I can tell you is that the early guidance, or the early work that happened on the direct payment guidance kind of happened by email chain, and there were definitely people from so NHS England, you may be aware, has a similar to TLAP, I guess, a reference group of personal health budget recipients who actively work with NHS England, the personalised care group it's called, to make sure all the stuff that they do is co-produced with personal health budget recipients. So that group was initially engaged by email. We've connected with that group. So the discussions we've had have stayed joined up with people who use personal health budgets. We have some people who join our regular calls, our discussions with government, who are personal health budget recipients. I think we want to improve that, to be honest, and work better together. But the short answer is that it's all been joined up. And if you look at the direct payment guidance, it's actually very. It covers both direct payments from local authorities and personal health budgets taken as a direct payment for personal health budget recipients. So it's pretty joined up. It feels pretty positive, and the voice of personal health budget recipients has been heard.
Definitely, and we've been bringing an awful lot of people who are on personal health budgets through the register as well. Rachel, can I come to you about any specific guidance for personal health budget holders?
Sure, absolutely. I'm not aware of there being any intention for the government to issue any formal guidance. I suspect there will not be any change in legislation for an employee to sort of, go into a mandated program in any way. However, I think it's a sensible thing for ILG support to offer some specific guidance for employers who are in that category that do have a very high risk of infection control. I think for that particular group, we can be a little bit more clear and determinative of our opinion. We can provide further guidance and already prepare a process, a flowchart, and set out a procedure for them to follow. So yes, I'm absolutely confident that we can put something together that will help that particular group.
Brilliant.
Thanks, Rachel. Just to add that, we'll add that to the list of our guidance sheets that we're putting together. That's great. Thanks, Rachel.
Super. Thanks, David. We'll come to David Thompson now.
Hi, can you hear me?
Yeah.
Yeah, I've got three quick things to say. The first thing is that vaccination for unpaid carers is only a footnote in the guidance, and it needs to be written properly into the guidance. So that's the first thing. The second thing is that lateral flow tests have been shown to be only slightly less than 50% accurate. So what we need to be pushing for PAs is regular testing on a cyclical basis, the same as care home workers are getting, because lateral flow tests are dangerous if they're only 50% accurate. And the third thing I wanted to say was, Oh, I've forgotten the third thing. It's always happens with third things, doesn't it?
Yeah. No, I think both are really important points, David. Thank you. Thank you. Tricia, is there anything else in the question box before I start drawing to a close?
There's lots, and I'm just trying to think about, I'm trying to prioritise. There's some very specific ones. I was wondering if you wanted to pick up that one about PAs, about GDPR, about people. That feels like an important one to pick up in terms of when payroll providers stand legally being asked to share data with local authorities. So there's a couple of people just in the last couple of minutes. Jenny, you've put, if the council is asking employers to provide their PA's details, how can we make sure not to breach data protection? We are the ones who employ the PA, not the council. Can we refuse to give PA's details but insist that PA contacts the council directly? It's just, I think that's a good point to pick up. Is that one, David, you could maybe. Is that for you, David, or Martin one?
I think probably David or Rachel.
Rachel, yeah.
Yes, I think there are a number of justifications to share data, and one of which I think is the most important really, is consent. If the employee has consented for that data to be shared, then you can pass it on. So in cases where you've got a PA who's absolutely keen to have the vaccination, ask them. Make sure it's covered in your policy, and then you are free to share the data. Otherwise, there are other justifications, such as when you have a lawful excuse or when it is necessary for you to fulfill the role that you have as the data processor, the data controller. So it may well be that if you already look to the data policy that most employers will have in place, there may already be consent within that. There may already be information that says we are going to share your information with our support organisations, with the local authority. Certainly the data policies that we have put together have already covered it off. So you will probably find that a lot of employers already have the right to do so.
Brilliant.
Can I just add to that? I've just had an email from somebody who's on the webinar just from a local authority saying that they are requesting that their clients give the information to the employee and forward that directly to us, therefore not breaching data. So there's obviously lots of workarounds.
Brilliant. Thanks, David. So that's all we've got time for. We're about 2 minutes off 11:30. I want to say a big thank you to all the panellists. Thank you for joining. I know that a lot of questions haven't been answered, but we're committed to taking them, and we'll do a question and answer sheet to the best of our ability that will follow up, and we'll send that to you after the webinar. Big thanks to Martin, Katie, David and Rachel and John for being on the panel. Big thanks to Tricia and Gaynor for supporting on the scenes, and Steph and Katrina, of course, for doing the interpretation. And just to let you know that there is a social care inquiry going on. So Anna Severide, who is a disabled person, is leading this inquiry on the future of social care. So I just wanted to just put a pin out. If you haven't seen that, it'd be worth getting involved in and giving your views on that. And tomorrow, talking about what John was saying about helping people to see how they are, there is a check-in session, a check-in webinar tomorrow, just to say, how are you doing? So it's a completely open session for people to just discuss whatever they want to do, just to check on how people are. And if you've got any subjects, or you want to repeat this one or do any other webinars, please do get in touch with us, and we'll try and set up as many as we can on different subjects that just help to give this information out as widely as we possibly can. So thanks very much for joining. Have the lovely rest of the day. Thank you.